Welcome and thank you for standing by. Today's webinar is being recorded. If you have any questions, you may disconnect at this time. At this time, all participants are in a listen-only mode. Welcome, my name is Megan Walters, and I am a health policy analyst with the National Center for Health Statistics. I am pleased to introduce today's speakers, Dr. Renee Gindi and Ms. Shelia Franco. Renee Gindi is the Chief of the Population Health Reporting and Dissemination Branch in the National Center for Health Statistics Division of Analysis and Epidemiology. She leads the team that produces Health United States, the annual report on the nation's health submitted to the President and Congress. Renee received her PhD in epidemiology from the Johns Hopkins School of Public Health. Shelia Franco is a team lead in the Population Health Reporting and Dissemination Branch of NCHS, the Division of Analysis and Epidemiology. She has a master's degree in health service research from the University of Minnesota. In this webinar today, we will introduce the redesigned, condensed annual perspective report, together with the new Health United States website and products. As part of the webinar, participants will learn what Health United States is, review new products, and get an update on the modernization of the program. The presentation will be followed by a question and answer session. Just a reminder, the audience is currently in a listen-only mode. Questions or comments may be entered through the Zoom Q&A box, and we will address them as time permits during the question and answer session following the presentation. And now I will turn it over to our first presenter, Renee.
Thank you so much, Megan, and good afternoon, and thank you all for joining us at this NCHS webinar, Reporting on the Nation's Health in Health United States. I'm Renee Gindi, Chief of the Population Health Research and Dissemination Branch in the Division of Analysis and Epidemiology, and I will be joined today by Shelia Franco, the Analytic Team Lead for the branch. Today's webinar is aimed at both new and returning users of the Health United States program materials. I'll start with an overview of Health United States and introduce the new design for many Health US products. Shelia will then take us through examining health disparities with the new Health US 2020-2021 Annual Perspective Report. And she'll close by sharing what comes next for the Health US program. NCHS is part of the federal statistical system with its 13 principal statistical agencies. As the nation's principal health statistics agency, NCHS collects, analyzes, and disseminates timely, relevant, and accurate health data and statistics. Our products and services inform the public and guide program and policy decisions to improve our nation's health. The major data collections at NCHS are at the heart of serving this mission. The vital statistics system captures birth and death records. The National Survey of Family Growth helps us understand changes to family formation. The National Health Interview Survey provides critical information about health conditions, risk factors, healthcare use, and health insurance coverage. The National Health and Nutrition Examination Survey provides detailed exam, laboratory, and dietary data. The National Healthcare Surveys look across the spectrum of healthcare providers and establishments to understand healthcare usage nationally. These programs are complemented by the NCHS Data Linkage Program, which maximizes scientific value of the center's surveys. Programs like Health US bring together reporting on all of these systems and, along with non-NCHS data sources, provide a comprehensive picture of the health of the nation. The goals of the Health US program are to educate and to inform the public about key health topics. Health US brings together health information from multiple NCHS and non-NCHS data sources. And with our unique focus on trends over time, we provide policymakers, health professionals, and the public an opportunity to track changes in the nation's health. Comparable trend data is essential for identifying where health disparities exist so that progress towards equity can be measured. The Health US program has long had a commitment to examining disparities between different population subgroups, including by race and ethnicity, age, sex, education, poverty level, disability status, health insurance coverage, and geographic area. Since 1975, the program's legislative mandate has been to present a comprehensive set of statistics on health status and determinants, healthcare utilization, healthcare resources, and health expenditures and payers. The Health US products have been continually reevaluated and redesigned to reflect the ways that readers search for, access, and use health statistics. In 2019 and 2020, our team took a systematic approach to understanding who was using Health US, what topics and analyses they were using most frequently, and why users chose these data. Each activity answered a different question about Health US users and their needs. The results of these activities led us to the decision that in order to better meet the needs of today's readers and users, Health US materials should be published online with the goal of more timely release of updates. Materials should also be redesigned to provide data users with more interactive access to the information contained in the detailed trend tables. To that end, starting with this new edition of Health United States, we've introduced a suite of new products with new features added to enhance findability, accessibility, and usability. A newly designed website presents analyses by topic. The new annual perspective report integrates selected analyses that have been published online along a single theme. The newly designed web pages for the 2020-2021 edition bring together the content that Health US readers are familiar with, plus new features to make it easier to find what you're looking for. On the 23 topic pages, users will see key findings, featured charts, and trend analyses on specific topics. The 43 trend tables provide data that support these analyses and are available both through the topic pages as well as on the searchable data finder. Topic pages now provide more direct links to the detailed methodological information on almost 100 new sources and definitions entries. One new feature making it easier for users to find the topics they're looking for is the reorganization of the site into topic pages. Each health topic is given its own page and draws from one or more trend tables. This slide shows the result if a user looked for topics related to cancer. Results include cancer deaths, reported history of cancer, and mammography. Let's dive further into cancer deaths. Once on the cancer deaths topic page, we can look at another new feature, the expanded number of trend statistics that the new program provides. The image on the left indicates the estimates from the beginning and end of the Health US decade, here 2009 and 2019, as well as a spark line indicating the overall direction of the trend for the total national population. The image on the right looks beyond the totals to further explore the topic. In this case, the graphic shows cancer death rates between 2009 and 2019 by sex. As a new feature this year, in addition to the traditional detailed trend statistics available in the text, users can now get a visual display of the trend statistics for each group in the featured graphic. This visual trend summary is provided to give users a more intuitive way to make comparisons between the observed trends. Another new feature is more extensive linking between the featured graphics, associated methodological information, and underlying trend tables. This linkage should remind users that the featured graphic provides only one look at the extensive information on the national trends and differences between groups that are available in those detailed trend tables. For the first time, users can browse through 5 editions of Health US in the online data finder, going back to trend tables found in the Health US 2016 report. Users can filter on more than 90 topic areas and more than 20 population subgroups to find the relevant tables. Data finder tables are currently available in PDF and Excel formats. In partnership with the NCHS Office of Information Services, the team developed a new set of infographic products based on the annual perspective report that emphasize the possibilities of integration across data sources for a given topic. These infographics are available both in the full page and social media friendly graphic snippets, and they're available in the resources section of the Health US website. Throughout the talk today, we'll be showcasing findings spanning each one of these suite of products, the trend tables, featured graphics, annual perspective report, and the new infographics. Again, our goal is to emphasize that Health US can provide so much more than a single annual report. There have been a number of ways that the Health US redesign has met the needs of users that were expressed during the research phase, ultimately improving the findability, accessibility, and usability of the report and the program. First, users should be better able to find the statistics that they're looking for. The topic-specific web pages are better optimized for web search than the prior PDF reports and should be able to guide users to relevant data more quickly. Next, the use of web pages instead of PDF increases accessibility, helping to improve access to content for all users. Finally, the redesign improves the usability of the information, both because users can navigate to relevant and related data more quickly, but also because the new format provides more space and opportunity for us to provide high quality assessments of statistical trend for indicators at the national and subgroup levels. At this point, I'd like to turn it over to Shelia to give an overview of the new annual perspective report and findings.
Thanks, Renee. Good afternoon, everyone. Health United States 2020-2021 Annual Perspective was released on January 19, 2023. This new publication from the Health United States program explores a single theme across multiple topics and data sources. Selected analyses from the Health United States online topic pages and data from the trend tables form the basis of the annual perspective. The theme of the 2020-2021 edition of the annual perspective is health disparities. Health disparities are differences in health outcomes that are closely linked with sociodemographic, economic, or environmental disadvantage. The annual perspective examines disparities by sex, race and ethnicity, insurance status, and socioeconomic status, including poverty level and education. The annual perspective draws from data sources collected through the end of 2019, before the COVID-19 pandemic. The timing of the data presented reflects data availability when the report was being written. Importantly, it also provides baselines of the status of the health of the United States before the pandemic and context for differences in health indicators by demographic factors. The 2020-2021 annual perspective examines health disparities across 8 health areas listed here. These are heart disease, cancer, HIV and sexually transmitted diseases, health insurance and access, substance use, hospital utilization, oral health, and risk factors and mortality. In this webinar, we will focus on risk factors and mortality, oral health, and hospital utilization. Let's first look at risk factors and mortality disparities by sex. This health area looks at healthcare use using data from the National Ambulatory Medical Care Survey and the National Hospital Ambulatory Medical Care Survey from NCHS. Substance use data are from NCHS's National Health Interview Survey and the National Survey on Drug Use and Health from the Substance Abuse and Mental Health Services Administration, known as SAMHSA. Mortality data from the National Vital Statistics System are also included. Data sources from outside NCHS are outlined in orange. For this topic, we only discuss one non-NCHS data source, but throughout the annual perspective, about 10 non-NCHS data sources are used. One disparity discussed in the risk factors and mortality page are differences in death rates between males and females. For the 2 top leading causes of death, heart disease and cancer, males were more likely than females to die of these causes in 2019. In the figure on the left, you will see that this disparity between heart disease death rates for males and females existed from 2009 through 2019. Despite decreases in these death rates for both males and females over the time period, the disparities by sex held. This infographic, taken from the information in the annual perspective, shows that doctor visit rates were 27% lower for males than females in 2018. And looking at the right part of the infographic, emergency department visits for adults aged 18 to 44, the age group that had the biggest discrepancy, were also lower for males compared to females. This infographic looks at male-female differences in substance use data presented in the annual perspective for heavy alcohol use, smoking, and illicit drug use. Substance use is more common among males than females. All of these differences are significant. It is noteworthy that for heavy alcohol use, males are twice as likely to report heavy alcohol use than females, and for illicit drug use, 1.5 times as likely. Suicide and homicide death rates among males are 3 to 4 times higher than the rates among females from 2009 to 2019. The figure on the right shows the discrepancy for suicide deaths from 2009 to 2019. You can see that the top line, the blue line, is for males and the bottom line is for females. These discrepancies by sex held throughout the time period. Next, we'll look at oral health disparities by poverty level. This health area presents dental visit data from the National Health Interview Survey. Unmet need for dental care due to cost data are also from the National Health Interview Survey. And expenditures on dental care and the number of dentists are from the National Health Expenditure Accounts and the American Dental Association. While the national supply of dentists has increased in recent years, the distribution is unequal. As we see here in the infographic on the left, the supply of dentists increased from 2010 to 2020. Yet, 60 million Americans still live in areas with a shortage of dentists. The map on the right is taken from the topic page on dentists, and it shows the differences in the supply of dentists across the states. In 2020, the number of dentists per population was lowest in Arkansas, Alabama, and Mississippi, and highest in the District of Columbia, Massachusetts, and Alaska. We looked at the utilization of dental visits by poverty level. As seen in this figure, for adults aged 18 to 64, those with lower income were less likely to visit the dentist in the past year. Adults with incomes 400% or greater of poverty were more likely to have had a dental visit in the past year, at about 80% over this time period. In contrast, those with incomes below poverty, or just above at 100 to 199% of poverty, were least likely to have had a dental visit in the past year, at about 40 to 50% over the time period. Of note on this figure is that you'll see that there was a break in the data between 2018 and 2019. And that is because the National Health Interview Survey was redesigned in 2019. There were some survey design and question changes, and therefore the data are not comparable across the time period. One barrier to receiving needed dental care is cost. This graphic on the left shows that dental care has much higher out-of-pocket costs than physician and clinical services, as much as 5 times higher. Looking on the right, we see that adults with lower incomes were more likely to report not getting needed dental care because of cost. More than 30% of those living below poverty reported unmet need for dental care in 2019, compared to only 8.2% of those living at 400% or more of the poverty level. Next, let's look at hospital utilization and disparities by insurance coverage. For hospitalization data, we used information from the National Health Interview Survey, the American Hospital Association, and the National Health Expenditure Accounts. We also looked at emergency department visits using data from the National Health Interview Survey and the National Hospital Ambulatory Medical Care Survey. This infographic shows that people with Medicaid are more likely to visit the emergency department and to have had a hospital stay in the past year compared to those with private health insurance or the uninsured. It's important to note that we restricted the ages to under 65, and therefore we're not looking at the majority of the Medicare population. The percentage of those aged 18 to 64 who visited an ED in the past year was about 1/3 of those with Medicaid coverage, compared to about 17% of those with private health insurance and 22% of those who were uninsured. There were similar disparities by health insurance among those having a hospital stay in the past year. We looked at ages 1 to 64 here, and among those with Medicaid, about 11% had a hospital stay in the past year, compared to about 5% of those with private or insurance or without insurance. These findings may reflect higher rates of disability and chronic conditions among people with Medicaid coverage. We also presented a chart of hospital stays in the past year for those ages 1 to 64 by health insurance status from 2009 to 2019. This figure shows that there was a higher rate of hospital stays for those with Medicaid throughout the period compared to those with private health insurance or with no insurance. As seen in this infographic, spending for hospital care represented the largest share of personal healthcare expenditures in 2019, at about 1/3 of all personal healthcare spending. Looking at hospital expenditures by payer, private health insurance represented the largest portion of payers for hospital expenditures at more than 1/3, compared to Medicaid, Medicare, and other forms of insurance. As a reminder, these are the 8 health areas that are included in the annual perspective and look at differences by disparity. In this webinar, we focused on just these 3 areas, but there's more to discover in the annual perspective report. As a reminder, these are the main products in the Health United States suite of products, and these range from topic pages with key findings, feature charts, and trend analysis, trend tables by demographic and socioeconomic populations, infographics of disparities in related health measures, and the annual perspective report with integrated analysis by disparities. So what's coming next for Health United States? Well, we continue to be making updates to the information that we're presenting on the website. This includes more topic pages covering additional health topics and data sources, and more periodic updates of trend tables and topic pages. With this redesign towards a web-based focus, we're not holding data for a single annual report release. And the next edition of the annual perspective will follow a similar format to this year's, looking at integrated data from multiple data sources. And we will be exploring a different theme across multiple topics and data sources. Future changes for Health US program will include machine-readable trend tables. As Renee mentioned, in the past, we've had Excel and PDF trend tables, and we think this move to machine-readable trend tables will improve usability and accessibility. We also hope to have interactive data visualizations to allow users to create their own customized charts. Some takeaways about the Health United States program. The Health United States products have improved findability, accessibility, and usability to better serve the needs of our users. And the annual perspective and other products present integrated multiple analyses and multiple topics. Further, most data in Health US 2020-2021 included information through 2019. For many indicators, trends were moving in the right direction. However, important disparities remained. The data in this suite of products provide the baseline information for future evaluation of how the health of the nation has changed after COVID-19. As you might imagine, a redesign at this level took a lot of hard work from a lot of people, both within the center and outside. I do want to recognize those listed on this chart. On the left, you see the names of the staff and contractors of the Population Health Reporting and Dissemination Branch. In the center, many divisions are listed from NCHS that helped us with these efforts, providing data, advice, and design. And these include the Office of Information Services, which was critical to redesigning these products. And also, I want to call out and thank the Office of Planning, Budget, and Legislation and the Public Affairs Office, which provided input on how to best meet the needs of our audience with these redesigns. We also had many partners outside of NCHS from both federal sources and non-governmental organizations, and you see those listed here. So now we're ready for questions, and you can submit them, as Megan said, in the Q&A feature. Any questions that don't get answered, please feel free to submit those to healthus@cdc.gov. And now I'm going to pass it over to Megan.
Wonderful. And thank you, Renee and Sheila, for a great presentation today. We are now entering the question and answer session. As time allows, the presenter will address questions from the Q&A box. Please submit your questions through this feature now. If your question or comment is not addressed, you may direct it to the email on the screen that Sheila just mentioned, or to paoquery@cdc.gov. My first question for you guys is, I noticed that your presentation included some data by state. Are there more health measures that are presented at the state or county level, by rural and urban status, or other geographical factors?
I can take that question. Yes, we do have other information at the state level and other geographic breakouts, including metropolitan and non-metropolitan, and in some cases region. We don't generally present data by the county level just for privacy and confidentiality reasons. But for example, by state, we have community hospital beds, active dentists, and active physicians. And by region, we have a number of tables that include that, including self-reported health status, cancer history, HIV diagnoses, heart disease prevalence, emergency department visits, and many, many more. And by urban rural, we also have that for a lot of those indicators that I just listed, and also for child and adolescent vaccinations.
Wonderful. Those all sound like great resources. My next question, I believe I'll direct this to you, Sheila. What new products or features can users expect in the next year from Health United States?
That's a great question. I mean, we have made a lot of changes, but certainly we're always open to more changes and we always want to improve usability. So one of the changes you can expect in the next year is we'll be bringing in additional topic pages and data trend tables and putting those on the website. We'll also be developing the annual perspective report, which will have a new theme compared to last year. And we might have some minor changes. So that'll be generally similar to the current report outline, but we might have some changes to those features. And then we are continuing to move ahead with machine readable data files for the trend table information.
I will also ask, and this is one that should be pretty easy, is there a place that users can access previous Health US reports?
Sure. If you go to the report page for the current annual perspective report, to the left of that page, there is a previous reports button, and you can go there and you'll be able to get access to previous reports throughout the years of Health United States. You can also find previous trend tables, as Renee mentioned, in our data finder. Going back to 2016, you can access the trend tables in particular there and some of the earlier charts, but the full reports are also on that webpage.
Awesome. Thanks, Sheila. And I'm going to drop a link to that in the chat for everybody in case you want to go back and look at those previous reports. So thank you. We had one question come in while you were speaking, Sheila, about the risk factors in mortality data. Does the report or the website show the data of productivity lost from mortality and morbidity of these topics?
We do not generally include that data. We do sometimes might include a reference to it. For example, if we had a focus on injury, we might, there's some data that looks at the cost to society from loss of productivity or other factors for injury. But normally we're not focusing on that area of health statistics.
Okay, awesome. And lots of questions about what we do and do not collect, and a lot of interest. I'm glad that you covered dental visits. We've had a few appreciative audience members talking about dental health, which is important. Do you track the number or the percent of dentists who take public third-party payment?
We do not currently track that in measures that are in Health United States. It can be difficult to assess that, but we're not currently covering it. But it is one of the factors certainly that affects the high out-of-pocket costs for dental care. That is, there's different levels of having dental insurance and different levels of acceptance of dental insurance.
Got it. I will pivot. This one may be directed best to you, Renee, but both of you feel free to chime in. And I'm going to learn from this one too. What does machine readable mean?
Yep,
Okay.
That's a great question. Machine readable is definitely one of those phrases that can mean different things to different people. We are trying to capitalize on another resource that CDC has. Data.cdc.gov is a place where CDC and NCHS store many of our data files, making them more accessible, more open to users, making it easier for users to download them and work with them yourselves. We are able to do a number of graphs and comparisons that make it easier to see trends and make it easier to see comparisons, but sometimes being able to graph those more easily yourself or being able to use it in your own analysis or your own presentation. So for us, machine readable means being able to put our tables in a format that are more accessible to that sort of platform, also make them easier to be used in visualization platforms, maybe ones that you're using on your own, things like R or things like Tableau, Excel even, as well as other visualization systems that we're working on being able to capitalize here at NCHS. So machine readable, that's a long answer. The short answer being machine readable is just making sure that we have each row, it's a long form file. Each row has an estimate and a standard error, but only one estimate and one standard error with other identifying information attached to the row.
I'll take this next one super quick. Is the webinar being recorded and will it be available for viewing later? Yes, it will. The webinar and the slides will be available on the NCHS website in the coming weeks after. So if you missed any part or want to go back and listen again to this presentation, it will be posted on the NCHS webpage. This, I'm going to piggyback off of what you just said, Renee, with data visualization tools. Are you using Tableau for the data and visuals? If not, what software do you use?
We are not currently using Tableau for the data and visuals. Right now, a lot of our analysis and initial work does happen in traditional tools that many of us have at our desktops, things like PowerPoint and Excel. The amazing graphics that you see both on the infographics as well as on the topic pages and the annual perspective are all actually professionally laid out by our Office of Information Services. So we are very grateful to them for the very high publication quality of these graphics. We are ultimately looking, again, with the machine readable format of the tables for the future, looking to be able to do more of that type of visualization using a platform like Tableau. But that's not what's currently accessible to our existing Excel and PDF files.
This one, I think maybe you can both tag team on it. I'm not sure who's better positioned to answer. They said, my question is, how will you address multiple race, sexual orientation, and gender identity in the presentation of data? Also, do you plan to use the new vulnerability indexes that you recently created?
Those are excellent questions, or a multi-part excellent question. So we do currently present data to the extent possible broken down by race and ethnicity, in some cases for confidentiality or privacy reasons, or some statistics aren't reliable because maybe there's a small data set. We can't present that for all groups, but we try to the extent possible to present it. And that does include, especially for the National Health Interview Survey, it does often include 2 or more races, so a multiple race category. As I say, we look at it and try to present it for other data sources if that's possible. Currently, we are not presenting information on sexual orientation and gender identity or on the new social vulnerability index, but it is something we're looking towards including in future editions and future updates. Many of the NCHS surveys, as well as other federal surveys and non-federal data sources, have been looking in particular at sexual orientation and gender identity. It is a very important measure. And so we do hope to be able to include that in the future.
Anything to add, Renee? Didn't want to
I was
cut
just
you
going
off.
to say, yeah, and that's for people who are not familiar with them, the social vulnerability indexes are classifications that are based on geography of where someone, either where an event occurred or an interview occurred. So being able to connect those to the health estimates. So we do have some surveys at NCHS that are currently putting out estimates that use and capitalize on that social vulnerability index. So in places where we have access to geographic data and we're able to showcase, again, with our focus on trends over time, we not only need to be able to showcase estimates within a specific grouping, but also to be able to have enough of those estimates that are comparable over time to be able to share some trends on it within those groups.
All right, I'm seeing even more praise for dental care, so bravo on that. Lots of people loving that dental care is included in Health US and commenting that it's, not talked about a lot in other instances. So glad that you all covered that today. Okay, well, that is all that we have for today. Thank you for your attendance and your questions in today's webinar. Like I mentioned previously, a recording of this webinar along with Sheila and Renee's slides will be posted on the NCHS website in the coming weeks for you to view after today. So thank you all again, and I hope you have a great afternoon.